We're seeing more and more professional athletes, including Shane Victorino, speaking out about their athletic and personal achievement amidst an ADHD diagnosis. But it seems like efforts should still continue in terms of decreasing the stigma of this disorder.
Yeah, I think without question. I mean, the fact that we started a discussion earlier on that physicians, neurologists, saying that the condition doesn't exist, which is nonsense. But I think that adds to the stigma. And again, I don't think this is different from ADHD from other illnesses that we need to address, particularly in mental health and mental illness, this idea that these are real diseases, these are issues with the brain, and that we need to keep a more open mind the way we should with all forms of physical or mental disorders.
People seem to know about ADHD and sports as separate entities, but it seems like a lot more awareness could be generated in terms of implementing some of the techniques such as behavioral interventions within the realm of sports specifically.
Yeah, I think so. I mean, certainly Michael Phelps, arguably the most successful athlete, period. Not just as a swimmer. And, his mother came out and talked about him having ADHD as a youngster and what it did. In fact, I wrote a paper talking about the new gold medal face of ADHD based on some of the interactions and reading about what Mr. Phelps did and how he achieved greatness.
And I'd like to see more resources that are easily accessible for coaches and parents and the athletes themselves that maintain and preserve the dignity and privacy of the athletes and their families. So whether that be through mailings or online or trainings.
We now have all 50 states require that coaches get some training in concussion in sports. A very good thing. So I agree. I think it all is about education, doing it in an appropriate way, dispelling these myths, and making sure that it's treated the same way that any other chronic disease is in youth, adolescents, or adults.
It really is part of their responsibility as coach to be prepared for that.
I think so. In fact, many of us have been really interested in getting people who are going to be coaches, in the undergraduate levels, training to be athletic coaches. In soccer, you go through these training programs to be a soccer coach, through AYSO, to have this be a part of their training to understand not only ADHD, but maybe even, other things like seizure disorder or diabetes.
What advancements have you seen, and what would you still like to see happen?
Well, I think some of the most exciting advances have been the capacity that we now have to look at the brain as it functions. Very sophisticated ways of kind of looking at the brain in ways that just didn't exist 5-10 years ago. And what we've been able to demonstrate now is ways of not only looking, is there a lesion in the brain, is there something there that shouldn't be there, but how the brain communicates with itself. And that's the core problem with ADHD. It's the way the brain functions. It's less efficient.
So where do we go from here?
Well, I think the first thing we have to do is what we're doing today is we need to dispel the myth that it doesn't exist. We need to make sure that the diagnosis is not used loosely, that someone who is lazy or someone who, has some other things going on, they don't get labeled as, quote, oh, you're just ADD. That it not be used as an excuse, but that it be appreciated that it is a condition that is highly treatable, and when not treated has very significant negative impact on life functioning outside of athletic performance.
Okay, Dr. Barron, this is the hardest question of all. Complete this sentence. A champion is?
Someone who dedicates themselves to achieve their highest level of functioning.
Dr. Barron, thank you so much for all of your insight. We really appreciate your contributions.
Thank you so much. I enjoyed it.